Hi there, it's Dr. Schuster, and today we're going to talk about my kids and their growth and the differences that I see with one that had lip and tongue tie releases and one that did not. When you have a lip and tongue tie as a newborn, it makes bottle feeding and breastfeeding difficult. It causes a lot of issues. You can have dribbling of the milk, you can have a lot of gassiness, you can have a lot of pain for mom, inability to completely empty the breast, which then can lead to infections. So as a mom having a one tongue-tied baby and one not, there were some significant differences that I saw there. And then also as a doctor, some significant differences that I see with my infants when they have tongue tie releases immediately before and after, and a lot of relief in those symptoms. But following them with their growth, my son and daughter have grown completely differently. So my daughter started growing down and out, and she started to get a gummy smile. And that is something that if you do not fix by the age of about 5 or 6, the top jaw is mostly done growing and you cannot fix after that. And so that's something that I have had to step into and start changing her growth pattern there. My son is growing beautifully. He has nice, wide, fabulous arches. He looks textbook. It's amazing. My daughter, because she didn't have that tongue tie release, your tongue, when it functions properly, goes up to the roof of the mouth, makes a wave-like motion to swallow, actually pulls a suction through your inner ears and helps to clean out your inner ear tubes. But kids, they get a lot more ear infections, so that tongue function is incredibly important. And so with her, we were actually getting a lot of ear infections that we don't see with my son, even though they're in the exact same environment. And then another thing, my daughter has developed snoring. She's developed mouth breathing, which is very highly related to having a tongue tie, and my son has not developed those things. That's something that we have been working on very hard now because my daughter still has a tongue tie. We haven't had that released yet because she's still very young. So we are having to work very hard right now to work around that and do myofunctional therapy. She has a myofunctional water bottle. She has a mouthpiece that she wears at night. There are certain things that we're doing to intercede on the fact that she does have that tongue tie so that we can get her back in the pattern of growth that she needs to be in.